Okay, hi, how are you?
Nice to meet you.
Hi, good to see you.
Hi, it's a pleasure to meet you. My name is Julie Almond, and I'm the CEO here at Home First.
Hi, Julie.
Today, don't you?
Yeah, it doesn't get any better than this.
I know.
Hi, how are you?
Good,
Good
to
see you.
Yes,
A
thank
pleasure.
you so much.
And you already know our Assistant Provost, Matt Roy, from the Ladue Center for Civic Engagement.
Yes, well, hi,
And you
David.
know our faculty and our students.
Yes, well, welcome.
Thank you.
So welcome. We're very happy to have you here today. We've been in this building almost a year. It'll be a year in early July. We moved in from a little teeny tiny space we had less than a quarter of a mile from here. We had realized about 10 years ago that, God, we've just got to find a way to get out. And through the American Recovery and Reinvestment Act, we were able to. What we didn't realize at the time was there were over 650 applicants nationwide for the funding, and we were one of only about 86 that got the award, and we got the maximum award of $12 million.
Oh, wow.
So we were able to move from a little place over there on County Street here, and so we're very proud. And for the first time in our history, we're property owners, and we have friends who rent from us. So we have a 340B pharmacy here on site. We wanted to start first in the community room. When we were over there in our tiny little squish space on County Street, we often had difficulty in finding a place to meet. And so when we moved in, as we planned this facility, we said we want a place where our community partners can gather if they themselves need space. So we have a community room over here.
Kitchen to see our kitchen.
Okay. Maybe to prepare lunch. I don't know.
They had lunch.
Oh, you did?
Tell me.
I was thinking maybe they were staffed.
Well, you know what they...
So this is our lobby. And it gives me goosebumps to say this, but when the architects got a better understanding of the landscape and the powerful source that the Quequechan River was to the textile industry back in the day, they designed this waiting area with the Quequechan River in mind, so that's why we have the design that is the way it is. And medical exam rooms, so we went from 13 in our former building to 27 here.
Wow.
And for the first time ever, dental has its own registration area, and we went from 5 dental rooms on County Street to 9 dental operatories here. So we're thrilled, and so we continue to hire additional staff. We have a dentist who's going to start in July and another one in October because the need for dental services in this area is huge. Right now people are calling, they want appointments, and so we're doing the best we can to kind of squish them in. But once we have those new providers, we'll be better able to accommodate the people that we serve. The clinical manager is right here and can tell you a little bit more about our care management program.
So we have a team of 2 registered nurses and 1 registered dietitian. She's also a certified diabetes educator. They came on board, 2 of them came on board last year, and actually they came on board 2 years ago with the help of the Attorney General grant that we received. So they do a lot of the preventative care. We do some cancer screening departments there with some patient navigators. They do education for chronic diseases, asthma, diabetes, hypertension, cardiovascular diseases. We recently, a year ago, became accredited with the American Association of Diabetes Educators for our diabetes education program.
I'm editor of the Journal.
Oh, nice!
Great organization.
Yeah, so we were...
You know what, I hate to say, but we're going to head back that way to the WIC program, kind of go around in a circle from there.
So this is the only FQHC in Fall River?
Actually,
Yeah,
you're going to be visiting STAR later on this afternoon. They are actually our sub-recipient. So we're the federal grantee, and STAR is our sub-recipient. So we have a very close working relationship with our friends at STAR. And I know you're going to be visiting their new facility at 1010 South Main Street, and then on to
Yes.
Stanley Street,
Stanley Street,
right?
yeah.
Wonderful organization, and we're proud to work with them.
So if you want to just take a peek down the hall where we have all our individual, we do cooking once a month, where we invite any of our participants to come. It's something different each time.
We'll be doing shopping tours with them, teaching them.
Yeah.
It's so good.
So can I ask you, how do you measure the impact of what you're doing? How do you know that they're absorbing
Everything
whatever
I
you
put in that
them?
computer goes to the state, so all my risks are kept on file by the state. So I know exactly what my risks are in this area. Low hemoglobin, overweight children. Right now, our biggest thing is postpartum, keeping their weight on after postpartum, not getting to the doctor. Big initiative is breastfeeding. Not enough moms in this area. We're the lowest in the state. Breastfeeding initiation and breastfeeding on for about 6 months. We're the lowest in the state. So we have a huge...
Sounds like a project right
We have a big breastfeeding group here. We're all CLC, IBCLC. So that's and we go into the hospital to see our moms. So the support's right there. We support them prenatally and postpartum, but still there's not tough in the neighborhood. Yeah.
So this is the admin area. Billing is down the corridor. Some of our outreach staff have offices down there. My office is there. Yeah, I tried to clean up a little in case you saw it. I don't want anybody tripping over anything. But we're going to head to the boardroom right there now. Same is true for us right now. 70 to 80% of our staff are bio or trilingual. And Fanny here is the manager of our Interpreting Services and Diversity Initiatives Department, and she just has a ton of knowledge.
We are well established as a small, we are very small, 3 of us full-time, but we are doing an excellent job trying to incorporate diversity, language, culture within the healthcare, which is very important. Most of you know that people come from different backgrounds with different culture. They bring a lot of trinkets that play a big role every day in their daily life. So our interpretation is different. I have been trained professionally to be a medical interpreter, but I have learned so much working here, Health First. It's a different thing to interpret for community healthcare. It's just so incredible. It's a beautiful ride. You learn a lot every day from your providers and from your patients. I believe that we take care of about 40-45% of the population that comes to the clinic with Spanish, Portuguese, Brazilian, and also Creole. Besides that, we do have Asians and different type of population that comes to us, and we need Pacific interpreters. Very easy, we just dial the number, ask the interpreter by language, and presto, we have an interpreter right away. I have seen the change within the community. People have empowered themselves. They understand the illnesses. Before, Linda Medeiros mentioned diabetes education. It is an incredible group of people that are working so close with the community, making a difference. But I do believe it's also because we are part of the clinical team. Every single patient does have a special need, and usually it's something to do with the culture.
I'm capable of doing that.
Nicest to be recognized by the Robert Wood Johnson Foundation was our level of collaboration. And they kept on coming back to that over and over and over again. And I guess the vibe out there is that you really can't accomplish things on your own. We can only accomplish things when we work together. The force of all of us together, the mission of all of us being driven in the same direction is what brings about change.
More impressive to me is the focus on prevention in terms of health and long-term strategy and working with youth. That's what I think, given those 3 legs to the stool, I think that's the strength: collaboration, prevention, and youth focus.
When we
came back from New Jersey, or shortly after we came back from New Jersey, there was a group in Worcester that said that they had heard about our award and wanted to hear more about it. And so Wendy and I went with a presentation that was similar to this. They wanted to hear a lot about youth in particular. And when we finished, I was telling Nancy earlier, when we finished, sometimes you can read your audience and sometimes you cannot. It's kind of like, are they getting this? Are they liking this? Or they don't like us? Or they want to go home for lunch or whatever. But there was one gentleman sitting there, and after Wendy and I had finished, he said, I'm going to be 65 in a couple of weeks. I've seen hundreds of these kinds of presentations over my lifetime, and I've never liked a single one. So I'm thinking, oh, okay, they kind of wonder what's going to come next, you know?
Are you sharing with us?
Yeah, it's kind of like, okay, it's the shoe dropping kind of thing. And he said, until now. And he said, this is the first time I have ever seen a presentation that didn't talk about just the what, but the why. And he said, you have completely destroyed my stereotype of agency presentations. And we had said we didn't want to do just a laundry list. I mean, we could have listed, we do this and this and this and this and this, but I mean, as far as the Robert Wood Johnson Award, so do they. They do walk to schools, they do bike paths, they do farmers markets, they do, people do those things. But it's the why and the how to some extent too. So that felt very good.
Well, and I was going to make a comment along those lines, Marcia, that for the people in the room who don't know your history, that you did it right from the beginning, that about 10 years ago when you did the assessment of the community needs, and then from the beginning it wasn't that you were starting new programs, you were bringing all the partners in, so that you've done the collaboration since day one with highlighting all of the great work that's being done in the city, but showing it in a positive, preventive light. I remember David talking about, the kids doing floor hockey in the boys club, and that could be showcased as a physical activity.
So in terms of our role in addressing educational disparities, so obviously you're hitting all of the factors underlying disparities. And it occurred to me as I thought about the community school initiative, the model that Iowa Harkavy pioneered in West Philadelphia, that it really does address the 8 conditions of learning, a curriculum that's rigorous and teachers that are well prepared, kids that are healthy, kids that are safe, a caring adult at home, a community that cares, all of those factors. And so in looking at this broadly, where do you see as the potential biggest impact? In other words, if you had all the resources, where would be the area that would account for the greatest change that you see, since you've been doing this work for 10 years? What is the 1 or 2 things that we could do? Well, because you can't do everything.
Well, but
which are the 1 or 2 things?
It is bringing your students to our community, your teachers to our community, regardless of what the area is, whether it's smoking cessation, whether it's violence prevention, health, well-being, it doesn't matter. That role model of a 20-year-old or an 18-year-old for a 9 or a 10-year-old kid who probably doesn't have a role model like that, probably has parents that are very busy, very engaged, very working outside the community, but never really have the opportunity to sit and talk to somebody, doesn't come from a culture where everyone is college-bound. Being able to connect with you and bring your students to us and our students to you, to me, that's the magic button. That's what's going to bring about change. Because I know what it did for me. I know going to Bella Abzug's office changed the way I viewed the world. One incident in high school changed everything. One 4th grader changed the way she viewed the world. So being able to get you guys to come participate in our programs, help us develop, help the kids develop programs that they can showcase, and then bringing them back to your world, big difference.
And trying to say, it's so, as an employer, and we're one of the larger employers in the city, we need you to help us get our people prepared. And I would say we don't have a good prepared workforce for our, and we need you to do that for us. We got a Robert Wood Johnson grant to help develop workforce. So we have very good people that come to work every day, but they may not even have a high school diploma. We need to give them a path so that they can become substance abuse counselors, so that they can become nurses. And we need to work with you to develop that direct care workforce and move them on.
So what was the impact of all this work on those numbers through the last, is it 10 years or 20 years?
12% dropout rate. We reduced the dropout rate. I was
Smoking
think
rates
about
have gone way down.
Right, have gone way down. We have more people that are involved in programs that support their health. Having 1,000 people participate in the Fitness Challenge, which is a program that not just is exercise, but also works on nutrition and well-being, being able to have work site, I think we have 18 work sites now, Dave, that are doing some kind of work site wellness, whether it's smoking cessation or walking groups or low-carb groups. So those things are happening. We need that data group so that we can keep track of all this, because it's only been, 10 years is a very short time when you're really trying to evaluate something. But I think that one of the things for me is that when I go out and I do presentations, when I talk about these things, people shake their head and they say, oh yeah, I heard about it. Or I have a friend that's participating in that. Or someone I know is taking one of those smoking cessation classes. So the word is out there. People might not be able to say it's partners that are doing it, but they can say these are things that are happening in Fall River. So slowly but surely we're making changes.
So we have been working with BCC, and actually we have an articulation agreement that if we can get our staff certified on the National Addiction Counseling Test, and you don't have to have a bachelor's degree to do that, they will give them 15 college credits. So we're getting them on the path. We're teaching them how to learn, but we need you to help us develop the path beyond BCC and into the master's program. Because if you don't have a license, you're not going to go anywhere.
We also have to recognize that we have to change culture. The culture here for many years was you didn't need a high school degree or a college degree, and you could still get a really well-paying job in one of the factories. You can make $20, $30 an hour and have health insurance if you work for one of the big factories. So the family culture of having to go to college to do better didn't exist. So we are still fighting against that. We have clients that come in, you know, on the end of their lives saying things, oh, my kids, they want to go to college, why are they wasting their time, spend all that money, what good is it going to get them? They can go and work on the floor at Pierce, Garment, and they can make, $25 an hour. Shouldn't that be enough for them? So changing that culture is only going to happen by us bringing the kids to your world and you coming into our world.
So I'm curious to see what the students are thinking. What
Like you said, bringing the youth to the college campuses, like I think that's really great. So even if we all of like the walker, bikes things, like people could bike around UMass-Dartmouth. Like we always do bike races around there. So why not bring elementary schools or middle schools?
As a matter of fact, Julie might have talked with you, and also Pauline Hamill this morning might have talked with you about the connectivity as far as bike paths are concerned.
Yeah.
Well, okay, there are.
That'd be great. You'll be able to bike all of them.
Well, in that same process, there are bike committees that have formed in each one of the towns, and I am a member of the Dartmouth Bike Committee, and that's one of the routes that we're talking about. And we have met with some of the folks at UMass-Dartmouth about making a bike path that goes around Ring Road.
And you're looking at that as a way to build college-going culture? Because that was the one I was talking about in particular, because you addressed it as,
well, I think
as a
getting
main
people
issue.
onto the campus. It amazes me when I talk to people in Fall River who have never been, not just to UMass, but even to BCC, which is down the block from the high school. And they've never stepped foot there because it's not part of their cultural framework.
I just want to say that our Jobs to Careers, Robert Wood Johnson grant, really taught me that, brought that home to me, that we have people in very responsible positions who are really smart, and they don't have a high school diploma, and they never related to that as being them.
Right.
So that was a barrier that we got them across, and once they did that, then they wanted to go to nursing school, they wanted to go on and get their master's degree. They always thought they were dumb.
It's great, but also to do it in a volunteer sense where we can do it for an extended period of time, not just one semester. Because those people, those children in specific, they don't want to see somebody come into their life for 3 months. They want to see somebody that's for years. Like almost like a big brother, big sister.
Career big brother.
Big brother. To go in, to helicopter in and out of a child's life could actually be detrimental.
And also, for us, that's rewarding for our personal growth, but also for our resume. We can say we worked with,
Make a difference, really.
Absolutely.
And so I think we realized, that's why Ira was our keynote, that we need to kind of, almost like, right now, we're doing service learning all over the place. If we were more intentional and more focused in the schools, we could be more impactful.
Yeah.
Yes.
That's your captive audience. You have a captive audience of students there who, again, can serve as those change agents.
Which, essentially, that's what I'm saying. I take my hat off to you because your long-term strategy is with youth. And I think that's, we need to have that be our long-term strategy as well, partly because there's not a single topical area that a faculty member can't connect to an educational institution, right? A school.
Right. And I think one of the things we're doing is trying to bring strength-based parent programming to the school. The family fun nights that Marcia spoke about and the parent cafes that my agency runs, which is based on the World Cafe model and follows the protective factors, gives parents the opportunity to talk about the strengths that they have in a facilitated situation to help them realize that parenting is a job that you have to do with someone else, you know, whether it's your community, whether it's your partner, whether it's your next door neighbor, that you really can't do things by yourself. And I think morphing the schools into a place where parents can get good, concrete information on child raising, resource information about what's available in the community, and a connection to the universities, that's the trifecta. That's what I see as the trifecta.
And some of the young girls were like, oh, where are you guys from? We're like, oh, UMass-Dartmouth students. And I mean, we're not that much older than them, so they're seeing us, like,
It's
real.
real.
And they're like,
It's
do you guys
real.
have any, like, application, like, tell us what to do, like, where can we go and sign up? So we're like, oh, we just want to
If they perceive you as cool, they want to do it. It's that cushion of
Yeah,
coolness.
they were like,
We used to talk about that in Girl Scouts all the time. What motivates kids if they think they're doing something that's cool and great and exciting, and they want to do it too. So when you're out in the community and we see how turned on you are, they get turned on as well.
Clear to me that you truly have a passion for what you
Just
do.
a tad. Just a
Just a
tad.
little. And that goes a long, long way.
As we were saying earlier, we're working with wonderful people who don't say, okay, it's 3 o'clock and my contract says I leave
Right.
now. There are people with whom I work, like this gentleman over here, who's emailing me at 8 o'clock, 9 o'clock at night, or on a Saturday or Sunday, and check out this website and so forth. There are people who genuinely care about what they're doing. They're not working to the clock. And it's I said earlier, I can't remember if I told you or if it was just Nancy, that I'm way beyond retirement age, and I won't, because this is fun.
Yes.
You know, we love what we're doing because we enjoy the people we're working with. We'd like to think we're making some difference. Are we doing it individually? Of course not, because you can't do it individually. But working with people like this who are so genuinely dedicated to what they're doing, that's, as far as you students are concerned, that's your ideal in life, to be getting up in the morning, to genuinely look forward to what you're doing. You know, sure, you get paid and you need to pay the bills and so forth, but you have to enjoy what you're doing. Life is too short. I'm saying this as an old lady. Life is too short to be getting up in the morning and doing something you don't enjoy doing. And we do.
Think about addiction nursing.
Yeah.
Think about addiction nursing. It's a great field.
I didn't bring enough cards, Wendy. You get on Fred TV.
So, yeah, hopefully that'll be a big draw-in for everyone, because I know there's a lot of people who would like that. We're also going to have live performers. Do we have any word on what that's going to be?
I want to make a comment and then I want to ask you a question. Firstly, I'm very impressed with the level of maturity and with the skill set that you've developed in order to put on an event like this. It's very, very impressive. My question is, have you thought about, or will you think about, the tolerance theme is spot on, but something around dropout prevention?
You know, to be honest, we never really thought about that. And it's going to be a hard question to answer, but at Durfee, the dropout rate has gone down because we have counselors at Durfee that will sit there and tell you, listen, you kind of need a high school diploma to get anywhere in life. Yeah.
The reason why I'm suggesting it for you folks is because there's nothing more powerful than peer-to-peer.
No, absolutely.
Hey, we recognize, and while there has been improvements, there's still a long way to go. And so, yeah, no, this is great for this time around, but just consider it for the future. Can you do something around dropout prevention? Because it would be way more powerful than what CD Rec is doing or, some adult group.
And to kind of go into that, one big thing we focus on is bullying within the community. That's our biggest, job here. And if someone's being bullied and pressured and they don't want to be in school, and that could cause to the dropout rate. So if we're working on the bullying part of it, we're helping bringing that percentage down.
So I guess you can say in the long run we are kind of doing it, but I agree with you, we could be doing more. You know, so we all have our background and we all see things differently, and we just all put into one, you know, one group, and we can sit here and have a, you know, mature conversation like you did say, and get things done. Go ahead.
Question: how did you did you get chosen for this? Did you volunteer?
Well,
okay, so you guys, this is like a job for you, like a paid job.
Yeah.
Okay.
One kind of like what we kind of like aim for is we work with GLBTQ youth and bullying. So we have members from the GSA. I go to the GSA meetings, Gay Straight Alliance, and we kind of like, you know, collaborate between the two groups, between us and them. We also work with family planning, which is, I don't know if you guys heard of that, you know, pregnancy prevention, parenthood and all that. Diamond Diversity Club, me and Mike gave a presentation to them, and we said, hey, if anybody's interested, we didn't tell them it was paid. If anybody's interested, come on down, and they both showed up, and they both got the job. We had 3 RPS kids here that were here. Unfortunately, they couldn't make it tonight, but we had 3, and they're a great resource as well, because you know, RPS is the Resiliency Preparatory School. So you have the kids that get kicked out of Durfee, and now we have their you know, point of view on the whole matter. I think it's just amazing that all 4 schools can come together and work on one topic, you know, without sitting here and arguing with each other. You know, there is kind of like that little, you know, I always push that Durfee's the best school, because it is, but we all get together. Any other questions?
I think we probably need to segue.
Thank you for letting me
Nice meeting you guys.
Hope you guys all have a good day.
Yes, have a good day. Thank you.